Thanks for staying with us. If you're asked what are the most important organs in the body, some will say heart, others will say brain. But today we'll be speaking on how to maintain a healthy heart. Joining us on the show is the CEO of First Cardiology Consultants, Dr. Yemi Johnson. Welcome to the show, sir.
Thank you. Good morning.
Good morning.
Right? Yes.
It is.
So the heart is such an important organ, and we hear a lot of cardiovascular disease, heart attacks, heart blockage, and these things happen so suddenly. You know, sometimes the most healthiest. I mean, I've lost one or two people who are they're healthy, they eat healthy, they're exercising, and somehow they just fall off. And you're thinking, what happened? Say, oh, he had a heart attack. How did that happen? So I'm really interested in this conversation and how do we maintain the health? It's kind of a broad question, but how do we start to have a healthy heart?
Okay, well, you've already said most of the things. You eat healthy, you exercise. What I can tell you is about 80 to 90% of the heart attacks I see are preventable. 80 to 90% of heart attacks and strokes are preventable.
Wow.
And I can also tell you that in Lagos, the people who come early with a heart attack, because if you come early, we can reverse the damage. If you come within the first 6 hours, there are things we can do to reverse the damage.
Okay.
And what I've seen is the people who come early are usually the foreigners, the Indians, the Caucasians. They come, as soon as they have chest pain, they come in.
Oh, wow.
And we can fix the problem. In fact, last night is a clear example of what happened. An Indian man came in with chest pain within an hour, opened up the blockage, fine. It's not going to have any repercussions from the heart attack. Nigerian, half his age, came in 48 hours after.
Wow.
He's got extensive damage.
Oh, my Lord.
Whoa.
So, and I remember when I've gone for international conferences, they ask me, what do Nigerians do when they have chest pain? And I hate to say, but most of my colleagues will tell you, the first thing a Nigerian would do is pray.
Pray.
Then go to church, then rub
Anointing.
balm,
Rub.
or anointing oil.
Boniki.
Then when all those things are not working, then they might go to a drugstore, and then maybe to a hospital.
Wow.
So we don't really understand what... So I'll talk about chest pain first.
Yes.
Once you're above the age of 40, chest pain should be taken very seriously.
Wow.
Even if I have chest pain now, I can't tell that it's a heart attack just by how it feels. You have to go in and have some tests done. All right? They will do an ECG, run some blood tests. And if it's a heart attack, there are certain things that need to be done. But we wait. We wait till the damage is done. And then you live with the consequences, which is you'll not be able to walk from here to there without being short of breath. You might be on oxygen the rest of your life. Things like that. So it's important to take chest pain very seriously. If you have chest pain, have it checked out.
What's the level of the pain that will get? Because sometimes body go just pain you.
Like, no, like Nigerian,
Yeah,
body will
body
pain you
will
now.
just
It's
pain you,
Nigerian.
stress,
As I'm talking to you right now, I'm having serious pain here.
At the back, yeah.
It's hurting
You
me.
know, so what's the level
I'm
that
start
will
looking for
tell
a
you
doctor
I need
because
to
of
get
back
to a
pain.
doctor?
Back pain can sometimes be deadly. Not all the time, but sometimes. So any pain up here, check it out. Just have it checked out. It's not that you're going to be admitted or have some
Dr.
expensive
Johnson,
tests
let me ask you a question.
there's
I'll come
no
to you,
truth.
Ms. Nimam.
All
The
right.
truth is that when I have a pain right now,
Yes.
I go to a doctor and I enter his office, he's likely to tell me,
Take painkillers.
take painkillers and send me home. He's not likely to do an ECG like you would do because you're a cardiologist. So you have an idea. But most doctors will just say, let me give you, people that are using
Just
paracetamol, let me
prescribe something
increase the dosage to ibuprofen or something else.
I hate to say that's what happened to the young man yesterday. Okay, when I was in medical school a long time ago, we had, throughout my 5 years in Idi Araba, we had one person come with a heart attack. It was rare when we were in school, one person, and it was a Caucasian. And all of us were brought to see the patient and see what a heart attack looked like. So for many doctors, heart attacks are still something in the textbook. But unfortunately, the incidence of heart attacks has increased in Nigeria for several reasons. One, we are not eating healthy any longer. We are not exercising. In those days, unless you had a car, and very few people had cars then, you'd have to walk to where you're going or take a bus and walk. So there's some exercise. Now you park right at the gate, and then you take an elevator 1 floor. No exercise at all. We're eating all these small chops at parties, puff, chicken wings, and all these things that are all fried. So we're eating healthy. There's pollution in the air. I mean, we're not eating healthy. There's pollution in the air. We're not exercising. There is an epidemic of diabetes in the country now.
Wow.
And that is because of obesity, being overweight. Most of diabetes is caused, type 2 diabetes is caused by being overweight. So that level has gone up. So we have all the risk factors. Hypertension, another big risk factor for heart disease. So we have all the risk factors, and we're not looking after them.
Okay, so you talked about the tests that have to be done, and I have had to, well, my loved one in 2017 kept complaining of chest pain. And based on my experience at the time I had my child, any chest pain is heart condition. So we went for all the tests, and the ECGs, everything just kept hitting a brick wall. We didn't find the cause of that chest pain. And eventually it subsided. So if you have to consider what you have to spend, and you know, to find out what is the cause of the chest pain,
and nothing, and you not see nothing.
And you see nothing.
That's the Nigerian factor
or is
right
it
there.
compulsory?
All I go through all that pain.
Consultative fee.
Expensive tests.
God bless you.
Well, you are correct. Not all chest pain is heart disease. In fact, most chest pain is not heart disease. So yes, most of us pay out of pocket for these tests. In the US, in UK, it's your insurance that takes care of it. So the paradigms are different, and that's true. You can end up spending a lot of money and not find out the cause of the chest pain. The important thing is this. When you go with chest pain, the characteristics of chest pain that you need to be very concerned about, it's central. It's like somebody sitting on your chest, or a baby sitting on your chest, or like your chest is in a vice and it's gripping. It goes up your neck, it goes down your arm, and you start to sweat. All those things are signs of a heart attack.
What about those that just drop dead?
That's a whole different ballgame. A heart attack can make you drop dead suddenly, all right? If you have a big heart attack, you can suddenly drop dead. There are many people who drop dead who had symptoms before they dropped dead. They just didn't tell anybody. A lot of that happens. But one of the warning signs is you walking up the stairs, you feel some pressure in your chest, and you have to stop. That's a very big sign that there's something going on. It's just not chest pain. Another one, especially for men, is pain during sex. That's a big sign.
Really? They won't tell you that?
I don't want you to get
You don't want to
disappointed.
be told weakly.
Yes, it depends on the person. But pain during sex is another important
Pain
sign.
in the heart,
In the heart,
during
not
sex.
The chest.
The
Oh,
chest.
the chest,
the
during
chest.
sex.
Really?
But your heart is supposed to be doing
Yes,
working
but
hard.
pain.
Okay.
Pain
is
that
different.
makes, yes, pain is different. So that's because that's exercise in of itself. And some people ask me, is sex exercise? I say yes, but exercise should last at least 30, 45 minutes.
Okay.
So it depends on the duration and all that. But pain with activity is an important sign. Pain that radiates down your arm is an important sign. Pain that's associated with shortness of breath or sweating is an important sign. Now, if you have pain and you move your arm, the pain gets worse. It's not likely to be your heart. That's likely to be something in the muscles. All right, so you can rule out some of the things yourself.
All right, so I know that First Cardiology Consultants is a rather high-end hospital. You know, many people can't afford it.
Yep.
But I know you're also doing the Healthy Heart Foundation, which supports people for cardiovascular interventions. Tell us about it. Is it because they feel that you're trying to just reach out to people who can't afford it, or you're just trying to do a sensitization on how to help people in getting healthy hearts?
You've already answered the question for me. Okay, let me give you some background. I trained in Nigeria. I was on scholarship throughout secondary school, university. You know, that time was during the oil boom, and all of us went to school free. You people might not have enjoyed those periods. And I went to the US right after youth corps, spent about 30 years in the US. And it used to irritate me seeing patients come abroad for minor things. They end up seeing one of us,
Yeah.
You know, they come from Nigeria to America and say Nigerian, and they sometimes get disappointed. But I can tell you in the US, in any field in medicine, there are always Nigerians at the top of that field. There are many of us, and they're always at the top. So I felt bad and said, okay, I've spent a long time here. Let me come back and give back to society. And it's been the most difficult thing I've ever tried to do. And cardiology is expensive. All the tests we do, all the procedures we do are expensive. So now, yes, we've brought the technology back home. We can treat heart attacks, we can treat strokes, we can do a lot of things. But majority of the people cannot afford it. And it breaks your heart when you see somebody who doesn't have the money but needs the treatment. You see, and as a single person or one person or a company, we can't really cover all those people. And it's one of the reasons why we've never made a profit, First Cardiology, because we end up treating people. You can't come in with a heart attack and we say, well, you don't have money, go away. It's not ethical. So we decided to, we thought about it, my partner and I, and said, let's see if we can come up with a foundation. Because we've seen many foundations, charity organizations. Some have lasted a few months, some have done very well. We said, if we do this thing properly, we can reach out to a lot more people.
Okay.
And that is what we're trying to do. Unfortunately, health insurance in Nigeria is not yet where it should be. It started. It's not going to, healthcare to the masses is not going to improve until health insurance is nationwide and is working properly. So this is our own contribution to see to the people who can't afford this thing.
So what's the foundation about? Tell us about what do you do? How do you become part of the foundation? Or what?
All right. What we did was we started it just informally, and we followed the example of Ghana. Okay. I went to Ghana, and all the citizens are subsidized for heart conditions. Sudan, the same thing.
Oh, really?
Yes. And Ghana's is run by retired bankers. It's not government, it's an NGO. But the people on the board are retired bankers and people in the business world who are well respected. So with that kind of board, people know that they're not there to just
take your money.
Yeah.
So we got that sort of board, and they've been very helpful. And what we're launching the foundation officially tomorrow.
Okay.
Oh.
All right, but we've been working for about a year.
Okay.
And we've treated about 50 patients.
Wow. So how are you funded? Who's funding you?
We've been reaching out to people informally, WhatsApp,
Organization.
friends, and the response has been overwhelming.
Wow.
It is once people know it's for a good cause,
Yeah.
they will give you money. They will give you money. First thing they wanted to know is First Cardiology. You people, you're already making money. Why should we give you money to treat poor people and all that? So we explained, when we do charity cases, we charge the foundation at cost, what it costs us to do the case. So there's no margin on it.
Margin.
It's whatever it costs us. And we've also been lucky. We've partnered with a foundation called VOOM in the US, which is a Nigerian foundation, but a lot of the people there are Americans. The American, foreign, doctors, nurses, all sorts of people who volunteer their time and come to Nigeria to do surgery. Okay. So we've partnered with them, and with the two of them, we've been able to really bring down the cost.
Okay. So I've been to First Cardiologist, and I wonder if your facility can take the crowd that would respond to free heart conditions.
No, we can't treat everybody.
I'm hoping that you're able to, partner other facilities where your people can use. There are other.
For example, you partner with the hospital in maybe Ikeja, and you can have some people go there. Or do they all have to come to First Cardiology?
Yes.
That's a great question. Right now, we've partnered with Abuad in Ekiti, and we've done some cases there. Okay. All right, because Lagos is just one place. We've done some cases with Abuad in Ekiti, who also provided services at cost. Okay. So we just came there, did the procedures, free for those people. Some patients, it's subsidized. Or excuse me, some patients, it's subsidized, but we try and just reach out to as many people. We intend to go out of Lagos. Next stop is probably Abuja. All right, Abuja would probably be the funnel for the north. And we want to go there and perform procedures there.
Now, what would be the criteria to pick the people you finally attend to, since you can't reach everybody?
Okay, it's two things. One is they need to have something. They have a cardiac problem. So that's easy. Clinical, we can make that diagnosis. And there are lots of people who need help, especially surgery or interventions. Then how to figure out if they can't afford it or not. Because yes, some people will game the system. I've seen somebody driving a brand new
Exhaust Jeep
Mercedes.
and says that he can't afford.
yes, you know, trying to game the system. So we have partnered with a group who specializes in things like that. So they vet the
Verify
people
them.
and verify and let us know that, okay, these people can't afford it, and then we try. But it's not a perfect system. But the key is, I'd rather treat somebody than not to treat.
No, it's kind of refreshing to listen to you because you're a Nigerian and you're trying to give back. And because we see a lot of people who want to jackpot. You've jackpot and you come back, and you know, and I like the choice of words you've been using. I've observed that even when you're talking about the insurance, that we're not there yet. So you didn't say we don't have. Oh, it's horrible. Oh, we don't know. But you seem like you're optimistic. So do you really think this foundation?
There's faith in there.
Do you believe that this foundation would really, that we need more of you? Do we think, how do we get more people like you? How do we get more Nigerians like you? Those who have gone, because I have a theory that it's not about getting Nigerians not to leave this country. You can't do that. What you need to do is bring back those who have gone like you. Find a way to get them home, because many of them are done. They're tired. They want to come home, but they need a conducive environment. So what do you think we can do to get more people like you to do stuff like this to help Nigerians?
Okay, I can tell you this. There are quite a few of us, well, I'm no longer them now, but quite a few of my colleagues abroad who want to come back.
Okay.
And the things you say is what bothers them: security, where to stay. Most of them, their kids have already gone to school, so they don't have that expense on their head anymore. So it's security, where to work. Most of the hospitals don't have the equipment they need. So at least I know now there's several hospitals being built in Nigeria. Private companies,
It's
equity
in
firms.
Lagos, not out there.
Well, it is, yes, they're in Lagos, they're in Abuja, they're in Port Harcourt. New ones being built that I'm aware of.
Okay.
There's Ekiti Abuad. It is amazing what Afebabalola has done there. It is amazing what he has done there, the equipment and everything he has. It's actually amazing. It's, It was mind-boggling when I went there to visit.
Oh, wow.
It's amazing. So there are people like that who spend their money back here and put it in healthcare. Now it's the professionals that is the problem. I'm actually working very hard on a system, and there are several of us. We have a group called DFC, Doctors for
Africa.
No, Doctors for, I don't know what DFC stands for again. No, Doctors for Progress. Anyway, something, yeah. Is all diasporan doctors who...
Doctors for Change.
Doctors for Change, thank you. When they see, I'm going to hear a lot about that, forgetting the C. When we've been thinking of how
Can bring
to
them
make
home.
things, and quite a few people are coming back in different capacities, different specialties.
Yeah.
And I can tell you now, in cardiology, everything can be done in cardiology in Nigeria except heart transplant. We will get there shortly.
I heard they did one in Ibadan.
No, not heart transplant, no, kidney transplant.
Kidney. Oh, I
Yeah.
thought, okay.
Not a heart transplant.
And so that's so good to hear, because sometimes we wait for government, but
Yes.
you are private people coming together, putting an organization, saying, you know what, this is, you guys can come back. You're finding a way to get them to come back to Nigeria.
Yes, because we are committed, and government is a different ball game.
Exactly.
Let me leave government alone.
Yeah.
That's a complex story.
Right.
But orthopedics, everything that can be done in orthopedics can be done here. A lot of people don't know all these things.
Imagine that.
Kidney transplant can
I've
be
seen
done
that
here.
firsthand.
Kidney transplant can be done here,
Yeah.
orthopedic and heart.
Neurosurgery. Many of
Neurosurgery.
these things can be done here. All right, a lot of people don't know.
What's all the money now? The money is the problem. It's not like
Yes.
you don't know.
They're
This is
going to
one
pay
reason
over there
why
too
we've
now.
got
It's not
this,
free.
No,
Let's
the
even
ones
talk
that are
about money.
traveling out are going for whatever reason. It's not because we don't have the capable hands here. It's because they just feel they are more trusting of the system over there, that at least oxygen will not fail you. You will not be looking for oxygen when you need it. So that's why they travel.
You have
But
NEPA. Your gen will
there are
break
issues,
down.
exactly. So they just prefer to go there. But we know we have. If you, there was a time during the COVID-19 now, my father-in-law did a surgery, a very major one. It was done here.
Okay, so what would be the minimum that you'd say a person must have or totally free
Benefit from this.
to benefit from this? You know, you were talking about some people would have to be subsidized. If you subsidize health for some people and you still have to find ₦1,000,000, that's not subsidy for them. So what would you say is the minimum?
Okay, the way we've done it so far, based on the recommendations from the group that helps us screen patients, those who can't afford, there's some people you know cannot, they can't even afford the test. You know they can't afford it. That's going to be completely free. That's, I mean, free to them. Between us and the VOOM Foundation, we found ways of trying to cover those costs.
Yeah.
We found ways of trying to cover. Because it's not like you're paying the surgeon. Most of the surgeons, most of the anesthesiologists, I have to mention the group that helps us, A3C, ABOAD, all our professionals, First Cardiology, we don't get paid for doing the charity cases. We don't get paid. So it brings down the cost. So there's a lot of charitable people around.
Doctor, any advice on how we can live to avoid, if this is actually avoidable? Because, you know, saying a person when no gets money, go know how you go keep yourself.
Exactly.
So that you don't get into some kind of
Yeah, so
problem that money cannot, you don't
looking
have the
for
money
Dr.
to solve
Johnson up and down.
Exactly. So, and for those people also that have this high blood pressure, I noticed that a lot of them do not even take the drugs. They don't even know they have it. What are some of the things we can begin to do so that we just, prevent this?
Okay, that's a great question. Like I said, majority of heart attacks and strokes are preventable. Majority, not all, but majority are preventable. First thing, go for your yearly checkups, all right? And if they pick up things like diabetes, high blood pressure, they put you on the medications. Take the medications. Number one reason why people don't take their blood pressure medications, especially men, is it might sometimes affect your sexual functions. And that's why they don't take it. That's why, and they won't tell anybody, they just notice that there's some issues there and then they stop taking the drug. The next thing now is a stroke. And what I tell them is, after you've had a stroke, everything's not going to work. So you might as well figure out how to do this. There are things we can do. There are over 1,000 drugs for high blood pressure. We can find a combination that will get your blood pressure down. All right, so one is taking your blood pressure medications. 2, diabetes. The epidemic of diabetes, where many of us are overweight. We need to watch our weight, eat healthy. I used to weigh about 100 kilos.
Yeah.
I now weigh, 78.
Wow.
And it's all this diabetes and things. And I was looking at the heart attack coming to me, and I said, okay, Yemi, better just respect yourself. So I lost weight, and it wasn't too difficult. You just reduce your portions, exercise regularly, walk. 30 minutes a day is all you need. 4 or 5 times a week. It really does help. So, and then that helps your sugar. Salt, hypertension. We eat too much salt in Nigeria. That's why we're one of the biggest hypertension capitals in the world.
Yes.
Nigeria is in the top 5.
Oh.
Let me give you an example. Recommended salt intake is 2 grams of sodium a day. All right? In England, the average intake is 4. And that's because there's a law that was passed about 15 years ago that restaurants and public food places can't add salt to the food.
Yes.
All right? You notice you go to England, the food doesn't taste so nice. So you add your own salt. Okay, in America, it's about 6 grams. In Nigeria, the average salt intake is 12.
Chineke.
So when a Nigerian says he doesn't take much salt, he's taking too much. Now, sources of salt.
Our food will not be tasty.
My mother-in-law will not eat my food, though. She will say, because you know, I'm thinking, it's too much salt for
No,
you.
you gradually reduce it. I don't say no salt. No salt is not possible.
Yeah.
But it might make you lose weight too because you can't eat. But hidden sources of salt.
This life.
Granuts, ekpa, cashew nuts, potato chips, plantain chips.
Auntie.
Those are hidden sources of salt that we don't realize. All right. So not
You know, right plantain.
bouillon cubes and all these things. They're salty. So just reduce the quantity. I'm not saying stop.
Right.
Reduce the quantity.
Doctor.
Food will not be sweet.
No, why can't always say something? Now something will keep us.
That's something
How can I die and now realize I stopped
Let
eating
it
jollof
kill
rice?
you when you're 90, not when you're 40 or 50.
Okay, I like that.
We have to wrap up. I think we need to bring you back, sir.
No
Because
problem.
Some of us need this this lecture.
tough
It's a nice
lecture.
lecture. I like it. We need a reminder. We hate, take fruits and vegetables, but this salt issue is very, very difficult to swallow. But it's all
But
good.
it's not difficult. You reduce it over time.
So you get
Yeah, if you just do it
And your
drastically.
taste will adjust.
Yes, your taste will adjust. And then salt will now taste not nice to you.
Yeah.
Your friends will not come to the house and say, "Ah, this your soup is not sweet though."
They should eat in
And
their
they
house
should go
before
eat in their
coming.
house.
Thank you so much,
Thank you,
sir. It was a
doctor.
pleasure having you on the show. I think this foundation is an opportunity for many Nigerians. And I like the fact that private people have come together to support Nigerians. And we hope that more Nigerians like you and your friends can come together to find ways. So I'm happy, just in case you missed it. If you have cardiology issues, it can be solved in Nigeria. Orthopedic issues can be resolved. I think you said, renal.
Neurosurgery.
Neurosurgery.
Renal, nephrology.
Renal,
most
nephrology.
specialties.
Most specialties can be done in Nigeria. Do your research before you can spend your hard-earned dollars. Our hard-earned dollars that should go to manufacturers to get equipment to help Nigeria. Don't you can use it to go and spend medical tourism when we can actually get it done here in Nigeria. That's all we can take on the show today. We'll see you again tomorrow. Bye for now.